So myopia is nearsightedness. And what nearsighted means is that you have sight only when it's near, right? So near sight is clear, okay? You're able to see near, right? You can't see things that are far. Things that are far are out of focus, right? You cannot see them, right? You can, if you want to be a pirate, near is clear, far blurred, right? That's another way to think about it. But nearsightedness, as far as like, not as far as like how the word is designed, you have to always think about it. Okay, so the image falls short of the retina, the macula, right? So why? Because we have a cornea that is what? Too convex. And since it's too convex, that image is going to be brought closer to that lens, right? That's just at baseline, all right? So what is the lens going to try to do? Is it going to try to get more convex? No, if it got more convex, it would even get closer, right? So what does our lens have to do to try to accommodate, try to bring it into focus? It has to get thinned out, right? So when it gets thinned out, hopefully you can just correct it. You don't need glasses, right? Then if your lens were to get thin out here, so let's just draw a line like that, then that would make the image go farther away, right? And hopefully it gets in focus, all right? But who gets this? 25% of the population. 1/4 of the population has a squished eyeball, right? An eyeball that is too long, okay? So the eyeball is too long. Your lens can do all it can, but how is it going to bring it into focus? It has to really, really work hard, get it super thin as possible to try to get it into focus. It can't do that, right? So they might need corrective lenses in that case, right? So you can think of as a curvy, convex cornea is what is going on with nearsightedness. We have a cornea that is way too convex, okay? So environmental, dim light reading, excessive close work, that could cause your eyeball to squint and cause it could cause you to really, it's actually been disproven actually. They say it's actually not enough sun, because when you're inside, you're not really using your muscles that much, your eye muscles and your cornea, etc. Not your cornea, your lens and your ciliary muscles. And having actual sun exposure can actually help with that and help develop those muscles to really work on that lens. Okay, so what's going on? We got increased convexity, increased curviness of our cornea, right? So it's super corny, I guess, right? And it's going to make that image, what's right here, there's just like grades of corniness, right? Right? So here's like way too corny, right? So what happens when it's way too convex? The image gets what? There's that. It's like longer drop. Oh, EKGs. All right. So yeah. So the image is getting closer to that lens when you have increased myopia. When your myopia is bad. Okay. So increased light convergence, and the image is closer to the retina. Right. And now it's like, well, wouldn't everything be blurry then? Isn't every image going to be, out of focus then? Well, this is where physics comes in, because light has a chance to equilibrate when it's far. When light is far away, the light rays are even when they hit your eyeball, versus a source that is close to you. Its light rays have not converged. I don't want to confuse you, but the light rays have not lined up, right? So if you imagine we have something that's really close, what's something that's close, like a cell phone, right? And it has all this light that's being emitted from it. On your eyeballs is like a 3D VR perspective right now, right? Those light rays did not have a chance to even out, right? So only so those things are, it's going to be more, it's going to be in focus, because if you look at the light rays here, this close object, those light rays are divergent. They are coming outward, and they're easier to focus, right? Compared to something that's nice and even like this, that's far away, right? Those light rays are going to do exactly, they're going to be as focused as possible. What's going on? All right, it's changing our ringtone. Okay, so yeah, so those light rays have converged, and they have equaled out those far away objects, right? And those objects then now are going to do what your eyeballs do best, and they're going to focus them. And if it's myopia, they're going to focus before the retina, right? Does that make sense? So it's something that's close, right? It's not X-rays, but it's light rays are farther apart, right? and not as many of them are going to be narrowed down, and it's more in focus. It's easier for your eyeballs to focus on it. Okay, so near objects, right, provide more light rays. They're more divergent, right, and they're able to be focused on because it's not something that's super far away. Something that's super far away is going to emit its light rays that it wants to emit. And we're not talking about like a star that's 1,000 light years away. We're talking about like something far in the distance, like 20 feet, 40 feet away. And those light rays have done all the light they can emit, and when they get to your eyeballs, they are going to converge because your eyeballs are good at converging, right? They're extra corny, and they're going to converge as the image as much as possible. Whereas something that's close, right? An image that's close, let's try another eyeball here, right? So an image that is close right here, right? Its light rays go outward like that, and the image doesn't, the image hits the eyeball at an angle, right? Versus these light rays that were far, they hit at a even angle, right? And they are going to be easier to converge compared to an image that is closer. That's why it's out of focus. You don't have to understand the why. You don't want to just because if it's light, it's near, it's in focus. If it's farther, it's out of focus, right? But that's why it is. Okay. And then of course your lens is able to accommodate as much as possible, right? If your eyeball is super corny, super curvy, right? Your lens needs to do what? It needs to get flatter, right? Your lens wants to get concave, but it can't, right? So it's going to get as flat as possible, has less and less convexity as possible, and to try to bring that image farther away from where it's focused already, right? It's going to try to bring that image farther away. It's going to try to get thin, okay? But you might need to get glasses, and that's what corrective lenses are going to do. The corrective lenses can get concave. And concave lenses, they are going to make the light rays go outward, right? So you notice when you have something that hits a concave lens, it goes outward, right? And that's what a near object does, doesn't it? A near object emits its rays outward, right? Compared to objects far away, then it goes, an object that's far away has time to equilibrate. But these lenses here are able to fix something that's far away, or even something that's far away puts it into focus, right? Something that's close will already be in focus. That's what nearsightedness is, right? So that's the idea, is we fix it with what kind of lenses? Concave or convex lenses? With concave lenses, right? Lenses that are concave will bring the images that are far into focus, okay? So that's the idea. So these people should be wearing these with driving, please. Okay, so again, any kind of image that's out of focus, right, for a long period of time is going to make you start getting headaches, make you get nausea and vomiting, and of course the image is blurred, right, because it is out of focus. Which kind of images in nearsightedness are blurred? Far images or near images? Far images, right? So the treatment is concave lenses, right? And concave lenses, we're going to do which the lens couldn't do. The lens tried to get as less and less convex and flat as possible to push the image closer to the retina, away from the lens, but it couldn't get it any more flatter than it already was. And then it was, now we have to introduce lenses, right? And the lenses, concave lenses, diverge the light rays. They diverge them, and they make it so that the light rays will then be in focus. Okay, that's the idea. Okay, so to recap, we got abnormal corneas that are too curvy, or we have an eyeball that is what? We got a squished ball. Okay, we got a squished ball, or we got a small ball, right? That's going to make it too close. Okay, and we need to try to fix that. Our lens can do as best it can to bring it into focus, but it might fail, and we have to introduce glasses or corrective lenses, right? They can be contacts or they can be glasses, right? We can even implant these contacts inside the eyeballs. All right, so hyperopia and presbyopia. So these are very similar. These are both result in farsightedness. So farsightedness means I can see far things clearly, right? So farsighted, I am, like if I were to hire somebody, are you farsighted? Yes, I can see things that are far, right? My vision is good at sighting far things. I don't know why that confuses me so much. All right, far-sightedness, right? So far is clear, near be blurry if you're a pirate. Okay, and then we want the image is going to fall behind the retina. Why? Because if the previous one was too convex, this one is concave. Impossible. You can't have concave corneas, right? Your corneas don't suck up against, and go inward, right? You don't have innies for your lenses or for your corneas. Your corneas are just too flat, right? So because it's too flat, did that image get closer to the lens, or did it overshoot? It overshoots, right? So where are we at here? So you can see the image is beyond the retina, right? The macula on the retina is not receiving the focused image. And to be in focus, that's where all the light rays converge as perfectly as possible. And now the image is in focus, right? So our eyeball might be too big, right? We got big balls and we got big tall balls, and that makes the image go beyond where it should be. Okay. So what else? We got a flatter cornea. That's usually the more common reason, but we have a cornea that is way too flat, and therefore the image overshoots the back of the retina, the back of the eye. Okay. So you have decreased cornea convexity. I could say it's more concave, but that doesn't make sense because that doesn't happen, right? It just gets less and less convex until it's just maybe 100% flat, right? So light does not converge. It does not converge closer to the lens. It actually gets farther from the lens, and it actually passes the retina, right? It goes beyond the end of the eyeball. Okay. So especially for close objects, right? Because what do close objects do? Their light rays get emitted outward, right? They don't have a chance to, like far objects do, to kind of make their light rays even, right? Light rays that are far away have time to do their thing and get even. And when they get even, then it hits your lens and it's in focus. But something that's close, right, like a strawberry here is close, like all the light that a strawberry gives off, right? Its light rays go outwards, right? And it's going to start getting out of focus. The light can't be focused as great as if it were farther away. If it's farther away, your eyeball can adjust as much as possible. How does your eyeball adjust? It fixes the lens, right? Does it want to make that lens flatter, or does it want to make that lens thicker with two C's, right? It want to make it thicker, right? So it's going to get more convex to try to fix that problem, right? So that's what your lens can do. Your lens will it gets squishy, it gets squished and pushed out, right? Your ciliary muscles will contract, right? And they will try to squish the lens to make it as fat as possible to try to bring the image from back there into focus, right? And that's what you do without thinking about it, right? I mean, you can try to get yourself out of focus, in focus, but whenever you see an image, your brain automatically tries to bring it into focus, right? But sometimes you can't do it, right? Because the image have a defect in your cornea, or you're not able to. Your eyeballs are way too big and tall. Okay, so you have to then what? You have to bring in some lenses. How do you fix this problem? Well, we want to push the image closer, or do we want to push the image farther away? When we want to bring this image, which is back here, we want to bring it closer, right? We did all we could on our own to accommodate and bring that into focus, but we couldn't. So we had to introduce corrective lenses, and our corrective lenses are what shape? They're convex, right? And the more convex they are, the more blind you are, or the more of a problem you are, or you have, right? So that's the idea. The way you fix it is with convex lenses. Okay. Now, what about presbyopia? So again, these guys are both farsighted. Presbyopia individuals and also hyperopia individuals, but it's for a different reason. So with someone that is hyperopic, they have lenses that are too flat. Sorry, I have corneas that are too flat. With someone that is presbyopic or has old eyes, right, their lenses have gotten stiff, right? Those lenses right there are now all stiff, right, with collagen becomes like not scarred but thick, and it's not able to contract and not able to get squeezed as much as possible, right? And that's the whole idea, right? You want to be able to squeeze your lens to bring the image closer, but what if you can't squeeze your lens? The image can't get closer, can it? Right? So your lens is stuck in what kind of position? In a less convex or more convex position? It's stuck in a flatter position, which is what the problem is with the cornea, but now we have a problem with a lens that can't get fat, right? That must be a good problem to have. So anyway, so you have a lens that can't get squished. So because it can't get squished, that means that you're pretty much kind of bored. You're bringing the images are going to be what at baseline? They're going to be farther away or closer from the retina. Images are going to be farther away, right? Because our lens is flat. When our lens is flat, the image goes past it, right? So things that are far have time to fix somewhat, right? Depends how bad your eyes get with age. But things that are close, they're going to be super divergent. Like this guy right here, right? That book, go right past he can't accommodate, right? So I'm getting that right now. My daughter shows me, a phone. Like, look. Oh, I can't see it that close. So you have to put it farther away. The light rays are divergent, and I need to get it into focus, right? So I got to bring those light rays a little farther away from me, all right, physically with my arms, because my lenses don't work that great, right? So my lens cannot get fatter and thicker to bring that image into sight, into focus. So I would just bring the object farther away from me, right? So old people get farsighted, right? And it's with just a lens that's getting thick over time, okay? So that's the idea behind presbyopia, right? The lens, not the cornea, is getting what? Thick or thin? Well, it's basically, it can't get thick because the ciliary muscles will try. The ciliary muscles will try to squish that lens, but it can't, right? So we can replace the lens. That's a surgery option we can do. Just replace it with something that's nice and pliable, okay? Or throw some glasses on them, right? It's cheaper. It might not be as, eye surgery is not really that high risk, but it's a situation to go through at least, okay? So what kind of lens do you throw on these people that have presbyopia? You go to the 99-cent store and you buy some readers, right? And those readers are what shape? Convex or concave? They're convex, right? They are going to bring that image closer to the retina, right? Because our eyeballs are flat. Our lenses are flat, and they can't get thicker. They can't get more convex. So we introduce some convexity to the equation. Okay, so that's the idea. Okay. So what else on here? So you need glasses to see near objects, because near objects are divergent with their light rays, and it's hard for us to get it into focus. And if we have hyperopic eyeballs, we can maybe move our lens, fatter or thinner? We can maybe make our lens fatter, right? If we have hyperopic eyes, and to bring that image into clarity, right? To bring it into focus. But if we have old eyes, we could try all we want, but our eyeballs are not working with us. They're not able to squish that lens because the lens is not scarred. What's another word? What's the word I gave to it? Stiff. That's a good one. All right. So the lens becomes stiff. Okay. So decreased lens convexity. All right. So how do you get presbyopia? Get old. All right. That's the easiest way to get presbyopia. But you can get it early, right? You get the deluxe package. Deluxe package being diabetes, ASCVD, right? Multiple sclerosis is another reason why that might happen. What else? And diabetes specifically, everything gets crystallized in diabetes. That's a song, isn't it? Anyways, so everything gets crystallized in diabetes, including the blood vessels, the nerves, but also the eyeballs. The lens changes and gets cloudy. Okay, and it gets stiff. If it gets cloudy, that's cataracts, which is also a problem with diabetics. Okay. What else? They can get dried out, and that makes them stiff, and that's with like antihistamine use. Things that will block or inhibit acetylcholine make things dry. So cholinergics make you juicy, right? It's a sludge, right? Salivation, lacrimation, defecation, vomitation, right? It makes you really, really juicy, whereas anticholinergics do what? Can't see, can't spit, can't. There you go. I didn't say it. All right. So that's what it is with anticholinergics, right? How do you even know what that was? anyways, that's the idea between presbyopia and hyperopia. They both have what? Nearsighted or farsighted? They're both farsighted, right? And how do we fix them? With convex lenses.
I'm going to use this laser and some lenses to show what being near or farsighted means and how glasses can correct for that. So this is about how your eye is supposed to work, where it would take in the light from far away and focus it down to an image on your retina, this yellow area across the back. That's where all the photodetectors are that actually let you see an image. Being farsighted would mean that the light is focused past where it's supposed to be. So on your retina, it's blurry. It's not quite at a point of focus. And being nearsighted means that that point of focus is too near. It's happening here before it gets to your retina. So again, things are blurry by the time they get onto the back of your eye. So if you're nearsighted, you need to move the focus back on your retina. You would add in glasses, and this is by far an exaggeration, but you see it as pushing back the point of focus. In reality, rather than pushing it way back here, you would push it back to focusing on the retina again. And if you are farsighted, again, the focus is past where it's supposed to be, you would add in an additional lens in the glasses, again, an exaggeration, but something to move up that point of focus, and the lens would be in front of your eye, so that that focus is moved right back onto the retina, and your vision is nice and sharp.
All right, so that's everything I said in just in like a minute or so. All right, what else? This is my mom whenever I show them something, right? They look, oh, what is that? Okay. All right, so astigmatism. That's a combination of increased convexity and decreased convexity. Our eyeball has topography problems, right? What does topography mean? That's maps, those cool globes in the 90s, right? It's like, oh, look at it, it's bumpy, right? You know they have that experience? You go to the store, anyways. So yeah, so you have like you try to find Mount Everest like super quick. It's like, look how bumpy it is. Anyways, there's different topography on your eyeball. Instead of just being curvy and convex, only a quadrant of your eyeball is that way, right? So here you can see a heat map, right? So red I think means elevation and green means depression, right? So you can see in different areas of the cornea, right? We're not talking about the lens, we're talking about the cornea. Different areas of the cornea are bumpy over here and not so bumpy over there, right? So it's like halvesies or quartersies, right? Or however you split that, thirdsies, right? So there's gonna be this abnormal cornea. So how does that happen? It could be just genetic. It could be surgery could do it. We'll talk about some of the surgery options. But another thing is keratoconus, which is more genetic. That's where your eyeball looks like this. It's a little bit pointy, right? And that is that's a coning of the cornea. It's due to eye rubbing, right? So here's an example of eye rubbing, what looks like an MRI. Just rubbing your eyes, it's just harmless, right? But your eyeball is literally being traumatized. It's like, stop it. There's a top-down view. Ugh. All right, so that's the idea with the keratoconus can happen. And then what do? We just give them, we have to reshape it, right? You can't just give, I mean, you can get glasses that are, you know, in certain quadrants this way, in other quadrants that way. But one thing we can do is just throw some contacts in them, or kind of like Invisalign, right? They measure their eyeball and they measure what the correct vision should look like, and they give them these little contacts that they can work up to or they have to keep in place. The problem is just like when I took my braces off as an adult, I didn't ever wear my retainers, right? You're supposed to wear them for life, and they put the thread of Jesus into you, but it's like I didn't. Okay, anyways. So yeah, so once you take them off, then 72 hours later, your eyeballs will return back to that shape. Otherwise, we need to get corrective lenses, right? The lenses might be convex, they might be concave. It just depends on what their situation is, right? We can't really predict which one it will be. We can predict if they are super convex, they need what kind of lenses? They need concave lenses. And if they have lenses that are super flat in one area, that area of the glasses will be convex, right? But either way, the vision, the image is probably not in the right spot, right, because of those changes in convexity, but also the image is scattered. So that when the light rays came in, they all came in and converged at one point. But when you have things that are convex and concave, or convex and less convex, and one ear and the other, now it's going right there, right there, right there. It's going all over the place, right? So at night, the lights are all over the place, right? They have this this ghosting effect, right? Is that the word I'm looking for? Ghosted. The lights are distorted, refracted, yeah, ghosting. Okay. So that's the idea with astigmatism, right? So it's eyeballs that are both convex and less convex. So here's the guy talking again.
In the past, I've used this laser and some lenses to show how an eye is supposed to work and then how things like near and farsightedness work. So normally, you would take light from very far away, focus it onto the retina, this yellow surface on the back of your eye, but being nearsighted means that your eye has some errors and actually focuses the light sooner than it should.
Too convex, right?
While being farsighted means that it focuses it further away than it should. And then you can use glasses, things you could put in front of your eyes, that shift up the point of focus, or if you're nearsighted, this is an exaggeration, but they push back the point of focus. That's how glasses work. But I also want to explain astigmatism. So in astigmatism, this lens in your eye has errors in one direction and not others. So let's say maybe vertically, you would be nearsighted, while horizontally, you would be farsighted or maybe even correct vision in that direction. And so because it has these two errors in different directions, either objects close or far away can both be blurry. So in that case, glasses would have to act like one way in one direction while acting like a completely other way in the perpendicular direction of the glasses.
Okay, and then what's this guy talking about?
So this is one of the craziest things I've seen as an ER doctor.
Can you lift it up a little bit?
This patient came in complaining of eye pain.
Contact. Look down more. We just removed 2.5 contacts.
So they already took out 2 contact lenses. And this next part is going to shock you.
How many?
I don't know. There's actually one.
Oh, God.
So those are more contacts that were lost in the back of the eye.
Okay. You're my Guinness Book of Record patient.
Oh,
So if you ever go to the ER and you're worried about an eye infection and you wear contact lenses, you have to let the doctor know. Because there are special bacteria that need to be covered with certain antibiotics.
I'm gonna have to count them. I think I've already counted more than 10 or 12.
oh, come on.
No.
All right, so they weren't taking their Invisaligns off no matter what, right? All right, so you can see with astigmatism, the images might be in focus some places, but it's definitely out of focus with all the other changes in convexities. Yes?
So is it that, because you're saying that it's only caused by either trauma, scarring, and squinting, if someone's born with, like, let's say, hyperopia or whatever, and over time they're squinting to try and see things that are closer, will that lead to astigmatism?
Depends how hard they've rubbed that part of the eye. Yeah, it can. All right, so that's the idea behind astigmatisms. So here's myopia here, hyperopia, and here the lens you put in is dependent on what they find in the eye exam, right? Rubbing her eyes again. All right, so eye surgery. So we'll take a break after this slide, right? So this is summarizing everything we talked about so far, right? So emmetropia is normal vision, and just FY, convex means the image gets closer or farther away. Think of a magnifying glass, right? If you have a magnifying glass here, and you have an extra beefy magnifying glass, that image is going to get super close, right? It's going to converge really nicely. Whereas concave lenses, right? Like a corrective lens, that's going to it's going to push the image farther away, right? So we need that when we have images when we have really, really convex eyeballs. Who has convex eyeballs? Nearsighted or myopic patients, right? And patients that are hyperopic have eyes that are too flat. So we have to give them convex lenses, right? So convex lenses versus concave lenses. And really, in presbyopia, of course, is going to also be a patient that has hyperopia. So you have to give them also what kind of lenses? Convex lenses, right? And then we have astigmatism. I don't know how we can change that. I think the projector is down as far as it will go, but either way, astigmatism is a little bit of both, right? You got funky topography is the best mnemonic I'd come up with, right? It's funky, its topography is convex, not really concave, but less concave in certain areas, right? So how do we fix that? Well, we can do LASIK eye surgery. You've heard of LASIK eye surgery, right? That's a cool thing to do. It was a cool thing to do in the 90s when it got approved. Now they have a procedure called SMILE, which is even a much, much smaller cut than LASIK surgery. I have a video here to demonstrate what that does, right? But all of these things are changing the keratosis. The keratosis is the cornea, right? Because we have refractive disorder is a problem with the cornea. Which one is not a problem with the cornea? Is presbyopia. In that case, we got to replace the lens, right? We could replace the lens, just kind of almost like cataract surgery, right? But keratotomy means you're cutting into something, right? You're going to do an otomy, like you're doing a sphincterotomy. That's putting a finger in a sphincter. I don't know why I think of that, but what else is good? Another good otomy. A craniotomy is going into the brain, right? They don't really call it an appendotomy, but what's another good word? I can't think right now. Either way, and you can think better than me. Right now, it's like you're exhausted after a test. Either way, keratotomy is cutting into something. So why would you cut into something and make some fresh apple pie right there, right? So they're cutting, and they're going to make it fall down a little bit, right? So it was super corny. It was super hyperopic. So what they did is they cut into it and flattened it out, right? And it was developed. It sounds very Russian, and it is a Russian procedure developed in Russia. It's like you have eye problem, I fix, right? And they cut into the eye, and it's very, very painful. And it might fix it, but at least the scarring is no longer really the best thing to do. We have more current procedures that we can do, all right? And by current, it means we can do radio frequency, like with like AFib, we do radio frequency ablation to create scar tissue. So we create scar tissue on the cornea, right? And that's a radio frequency, or is it over here? Radio frequency. I use your label. There it goes. A little probe that emits radio frequency. It's a little bit more. What's the word? More, not illicit, what's the word I'm looking for? More delicate, more intricate than cutting into it with a scalpel, but it still has some of the same problems. But the other nice thing is though, like when you heat things, like when you're blowing glass, you can actually make things more corny, or you can flatten it down, right? So this can be used for hyperopia or myopia. You can, it's kind of like you're like using heat to make it more pointy, right? Because someone has hyperopic flat corneas. We can use that, right? We can use CK right down here, right, for hyperopia. But again, we got better options out there, right? So keratectomy. Again, kerato, and we're cutting into, all right? But we're going to not only cut into, we're going to take it out, right? We're going to take out a piece of the cornea. We're going to melt it down. We're going to thin it out, and we're going to thin it out with lasers, right? And that's what a laser in situ keratomileusis is. That's a LASIK eye surgery. All right, and there's an example of it here before I start drawing too much on the screen. Okay, why can't I select it? Oh, there it is. Okay.
Degree of vision. PRK, photorefractive keratectomy. Remove corneal epithelial cells by a solution. Then use a laser to reshape cornea, i.e. making it steeper, and then apply a bandage contact lens. Side effects include pain, and recovery is in 1 week at least. It corrects 2 diopter hyperopia. LASIK, laser in situ keratomileusis, corrects up to 4 diopter, a famous and frequently performed surgery nowadays. In this procedure, a device, keratome, slices a flap of cornea, 160 micrometer. Laser is applied to change the corneal shape, and then the flap is repositioned. Advantages. Advantages over other procedures. Absence of post-operative pain. More rapid visual rehabilitation. Conductive keratoplasty. It involves getting radio frequency energy to corneal stroma, causing change in its shape. Can correct low to moderate hyperopia.
All right, I'm not sure I'm on the teacher network, and it should be faster, so I apologize for that. By the way, LASIK eye surgery is you're taking a really, really small cut into the cornea, and you peel it back, right? You adjust the cornea some more, and then you put it right back in place, like its own little bandage, right? And it will adjust someone's myopia, okay? And then PRK, that's where you use chemicals and you reshape it with a laser, right? That's the PRK right here, chemicals and lasers to reshape it. And obviously that's gonna hurt more. And also you can't swim for 2 to 3 months, which I know you all wanted to do, right? While the other eye surgery, you can swim after 1 month usually. All right, keratoplasty, that's where you take someone's dead eyeballs and put it on your own. Some donation corneas, okay, from a healthy tissue donor. And then implants, that's where you get actual implants into your eyes, right? So you can put a implant right in front of the pupil, or you can put an implant right behind the pupil, right? And you can exchange a lens, and that's actually going to help with someone that has like cataracts or a diseased lens, such as someone with presbyopia, right? And then what else? Implanted contact lens, that's subcorneal. It's like in front of the iris, in front of the pupil, right? And that's to correct, and it goes, again, that can correct vision, and you can make that concave or convex. Okay, so that's the idea. What else on here? So I guess this, I forgot what this is, chemicals, right? That's a PRK. And what's, oh, that's Russian right there. Okay.